Broadcasting live from the Orlando, Orange County Convention Center for HIMSS 17. It's This Just In. Now, here's your host, Justin Barnes.
Welcome to the special edition of This Just In of HIMSS Radio. I'm your host, Justin Barnes. We'll be broadcasting live from the HIMSS 17 annual conference inside the beautiful Orlando County Convention Center. Let me also introduce my radio and on-air producer, Ryan McPherson.
Hello, Justin.
How you doing, my friend? It's great to have you back on the air.
That's right. We're year number 2 for This Just In at HIMSS here in Orlando.
That's right. It's great. We have a great partnership, and you're one of the best producers in the industry, so I appreciate your time, my friend.
You're too kind. Thank you, sir.
And many thanks to everyone who has joined us already here in person, and certainly to everyone listening via the Business Radio X and the Healthcare Now radio networks. We have the industry's most sought-after CEOs, CIOs, care providers, policy leaders, visionaries, and you can find them all here on our show. But our goal is to really bring you the latest in healthcare, innovation, strategy, policy, entrepreneurialism, and surely best practices, as well as strategies to successfully navigate the future of healthcare. Your physician practice, your company, or even your family through all these changes occurring across healthcare today. There is more opportunity than ever before for all of us to thrive. But we must really understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. Without further ado, let's go ahead and bring up my first guest. Please come up here. Denise Hines, CEO of eHealth Services Group. But as importantly, you're the board chair-elect for the HIMSS North America. So fantastic. Again, great to have Denise Hines on the panel today and part of our show. So welcome.
Thank you, Justin.
And you're a return guest.
Yes, sir.
I love it. So before we dive into some of your cool duties, you've been active in HIMSS for many years, but what was your goal when you first engaged HIMSS and started coming to the HIMSS conferences?
My original goal was to learn more about public policy. I was working in the industry in health information technology, but I also saw the need to influence the direction of health policy, health information technology adoption policy, and how it can be used in healthcare. So that was really my purpose in getting engaged with other healthcare professionals, healthcare IT policymakers, and HIMSS was the perfect place to do that.
Yeah, I couldn't agree more.
To participate, not only watch and listen, but to participate and provide perspective. Yeah,
and I'll pick up on that a little bit because I completely agree. HIMSS gives you a platform to learn, but it also gives you a strong platform to engage.
That's right.
And to make a difference. And so if you're a doer, it's a great platform for you, an organization to engage. But if you just want to learn and listen, you can do that as well. So I completely agree. We both are very big fans of HIMSS and what they've been able to bring to our lives and how they've been benefit our companies, even our families in a lot of ways, because a lot of us are connected through healthcare in every way. So tell me, what are some of the initiatives that you're most engaged with within HIMSS?
In HIMSS, Health Information Exchange, obviously, with being the executive director for the Georgia Health Information Network. So Health Information Exchange, but also education, working directly with providers to help them understand the complexities of the regulations that they're facing every day that require them to adopt health technology, but also help them understand the benefits along with the regulatory benefits of adopting technology. So that's probably my favorite part of what I do, working with providers and translating the complex regulations into how it can help improve their practice and their healthcare delivery, but also the impact on patients.
Right.
And then, of course, Health Information Exchange and how the exchange of information can also improve healthcare delivery on a daily basis.
Tell me a little bit about this initiative, Women in Health IT, correct?
Yes, one of my favorites.
Yeah, so I had a couple of the members, Karen DeSalva. Salva was here, and Susie was here from EY, Granzanik. So yeah, great initiative, but tell us about it, it's exciting.
So Women in Health IT, that whole initiative is really about bringing to focus the contributions that women make in health information technology. But also, even greater than that, encouraging other women to participate and come into the industry, providing platforms for other women to talk to each other about our challenges in health IT. So it's been just a tremendous effort. I'm really pleased with the work that HIMSS is doing around this. And Carla Smith, I'm going to thank her for taking this under her wing and really just getting it out there. I don't know if you've already heard, but last night the reception, I think, was over 700 people.
Wow.
If I'm
That's
hopefully
impressive.
I'm not overestimating, but I think it was
Yeah.
at least 700 people there at the reception. And then the awards banquet was wonderful.
Excellent. Yeah, I had Carla on yesterday, and she previewed it a little bit. And then we moved on with Dr. Salvo and Susie. So we love the initiative. And also, I think one of our good friends, Jen Denard, is also involved in Women in Health IT. And I think HIT Chicks or Hit Chicks is another one. So, no, phenomenal. So now, shifting gears a little bit.
Okay.
I guess it's very exciting that you're the board chair-elect. So I want to hear more about, what are you thinking for 2017, 2018 for HIMSS? You personally, what are some of the initiatives that you think you're going to focus your administration on and your team on?
Okay. Well, of course, with the change in administration, I think all of us are watching and cautiously optimistic about what could possibly change the direction of where we've been heading. You and I have been engaged in this industry for a long time, and we've seen the dramatic adoption of technology and where we think it's going. So we're optimistic about the work that we'll hope to continue and the support that we've received over the years for that. So, of course, watching the environment, the political environment, and the support for health IT will be a huge focus of this year, next year. But also, personally, in my role, I look to continue the Women in Health IT initiatives. That's obviously very important to me. But also work on diversity, encouraging youth to look at health IT professions, people of color to engage in health IT professions. So that's going to be one of the opportunities that I'm going to personally undertake and work with more diverse groups to engage them in health information technology.
Yeah, I was actually just discussing that with our friend Dominic Mack.
Yes.
Not even a couple minutes ago, and I think there's a panel tomorrow that I think I met Optimin, or there's a member of Optim's team is helping you manage that process here. And so, no, phenomenal initiative. And then obviously Women in Health IT and picking that perspective up and moving. So I think that's terrific. Going on to the policy side a little bit, I guess I'm optimistic. I think we're both eternal optimists. So that's probably why we're friends and why we love our industry as well. And I'm sure you've worked with Tom Price as well through the years. We're both from Georgia in the Atlanta region, and Tom's obviously our congressional member. We're obviously going to take a look at, any new administration is going to look at current policy and then kind of put their flair and flavor around it. But Tom voted for MACRA, and that was a full bipartisan and bicameral piece of legislation, one of the only ones that I'm aware of in the last couple of years that flew through Congress. So, I do see support. I'm optimistic for it. I do believe he's going to focus, some of the efforts on making sure reporting is going to be fair and we don't add too much burden, and we're looking at the program from that perspective. He cares about care providers. He's a care provider himself. So I'm optimistic by what Tom and his administration is going to do. I've known him for about 17 years now, so I'm bullish on it. But any thoughts that you have?
Well, I think we will continue to see the strong support for the adoption of technology, and we've seen some new regulation come out, and the support for technology around biotechnology and cybersecurity and some of the newer technologies, precision medicine. So I believe we'll continue down the path of technology adoption. I think we'll see somewhat of the work to balance the regulatory requirements and burdens for providers. So I think we'll continue to watch the optimistic view of technology adoption, but making sure that we consider the perspective of the provider and reducing the administrative burden that they're facing will be
front and center.
Right.
Yeah. So not to put you on the spot too much, but do you think, is there something in 2017 or 2018 per se that we may not see in the horizon today? And the answer may be no, but do you see a new focus coming for us, or is it just making what we have better, or is there another piece of, like, we just had 21st Century Cures Act pass? Do you see anything else coming in a little bit of a crystal ball, or is it just improving what we have?
Well, I think it will be a little bit of both. The improving what we have. We've seen over the years tremendous adoption of electronic health records.
Yep.
But now it's taking that to the next level of precision medicine, data management, and predictive healthcare, and looking at socioeconomic factors on data and health outcomes. And so really taking, hopefully by then, providers will have adopted electronic health records, contributing data. Data analytics will be, of course, continue to grow. But really looking at that data and analyzing it and predicting and preventing outbreaks and chronic diseases is where we'll start to see. And that's really some of the focus of the 21st Century Cures Act and some of precision medicine. So we're starting to see that emerge with the laws coming out to support that work.
Yeah, actually, you're right. And you bring up some very good points, because we have, and I had John Halamka and Anish Chopra here yesterday, and we're talking about, we have access to a lot of data, but I don't know if we have access to information quite yet. And I think this is the era that we're using more intelligent systems. I certainly do understand the theme of artificial intelligence and AI and the excitement around it, and I think that's excellent. And IBM is right behind us, so I don't want to say it's too loud. But I love what they're doing. But I also think just having access to intelligent data, never mind artificial intelligence and all the intelligence are wrapped around that aspect, but just being able to look at data, understand data, and what does it mean, and how do we implement, I think is really the next chasm that we're going to cross through.
We haven't talked about it much, but thinking about the workforce that will be needed to help interpret data.
That's right.
We've talked a lot about cybersecurity, and we see the shortages of skilled personnel in that area. So I think we'll start to see new markets of health IT workforce emerging as well to help us go to those next levels.
That's a very good point. And I touched on that a little bit yesterday, but it was a stat that I read yesterday morning that 90% of children born today will have jobs that we haven't even thought of yet.
Right.
That's amazing. I mean, children born today, 90% will have jobs that we haven't even thought of today. So to your point is, we don't even have people to feed these jobs, and that curve is just only increasing quickly.
Yes.
So it's a very good point. I think that's actually one of the areas we crossed paths as well, was trying to get the colleges, trying to get these programs ramped up back in 2010, 2011, 2012 to begin to fuel our industry in health IT and the backgrounds and the experience that we need.
Right,
So.
and of course back in Georgia we work very closely with a large group of people there to talk about curriculum for the colleges and what needs to be included. So I hope to continue that work as well.
And Gwinnett Tech and Morehouse and Georgia Tech and all of them. So.
That's right.
Very true. Well, Denise, thank you so much for joining me. You're always a pleasure to have. You were my first guest today. I wanted you specifically to kick off the day. You always make my day brighter, and you're going to make HIMSS even better when you're the chair. Come in July 1st, is it?
That's right.
Awesome.
And
Denise Hines.
thank you, Justin.
Thank you, Denise. Talk to you soon.
Who's next, Justin?
Dr. Harry Greenspun, Chief Medical Officer and Managing Director for Korn Ferry Health Solutions. Thank you very much, my friend.
Justin, always a pleasure to be here with you. We're making like an annual tradition.
Exactly.
I like this.
We'll keep it going, too. I like it, too. But special, you're my last guest for this year at HIMSS. So, and I'm not sad because it's been a long 2 days.
I saw you hustling out there, so I know it's been hard for you.
Well, that was kind of interesting because I went to get a quick cup of coffee. We had a 12-minute break, and I sat in line for 9 minutes of the 12-minute break, just trying to get a cup of coffee. So.
That is a struggle.
So, but I appreciate you joining me, and we're going to have a little bit of fun here just because you are my last guest. We want to keep everybody entertained for sure. But obviously, we've been around the industry for a while. But what are the main reasons why you attend HIMSS each year?
Well, I think number one is for the people, right? Is that, this is probably the one place where you can run into everyone you really want to see.
That's right.
And, I think what's also interesting is that it gives you a flavor for how the industry is changing. Because, I'd say like 80% of what you have here carries over year to year. And that changes, but that 20%, that sort of new edge of like, what's the new vibe? So remember, way back when all of a sudden analytics started popping up. up, and then populations, started popping up.
Yeah,
and now, we're getting to smarter and smarter stuff, and wearables, I think, kind of came, and then I don't know where they went. I think they went to CES in Vegas. They like Vegas better. So, but that's what's also very interesting, and just the vibe of the industry, and that changes year over year.
Well, when we smart healthcare, you hear artificial intelligence, or just people are trying to say it's just intelligence inside our systems becoming smarter, So I think I completely agree with that. What trends are you seeing? So we mentioned a couple, but outside of what we just talked about, what else do you see?
Well, I think one of the interesting things is, the issue of how much smarter our devices are. And that we get capabilities, that we're having the ability to do more stuff. Individuals, patients, consumers are having the ability to do more things on their own. I think more importantly, though, is that it sort of highlights a bigger issue that, we're seeing that, that the electronic medical record, the EHR, is not, the central point of the universe anymore.
Right.
It's, that healthcare has become a large-scale enterprise. It involves lots and lots of folks inside and outside the enterprise, and we're seeing lots of other players coming and saying, look, you need to deal with customer relationship management. You need to deal with remote monitoring. You need to do a lot of other things that aren't related to the documentation of care delivery in a healthcare setting. So that's where you also start seeing issues around interoperability. That's going to be much more important because it goes beyond how do I exchange information from my EHR to your EHR to how do we actually collect a lot of interesting data and bring in lots of new players in a meaningful way to improve their health.
So you bring up a good point, because my last guest kind of roamed the floor and got a little sense for what's happening out there and kind of latest and greatest. And one of the perspectives he brought back was there's a feeling that we are going to have more, we're not going from this big monolithic systems, we're going to go to more plug and play, or we're going to go to more modular approaches to tackle what we need to tackle. And I think that's fantastic, because that would support entrepreneurialism and just consumerism in every way, or most ways, and just an industry that become much more vibrant if we're talking about that type of innovation being injected into our care plans, into our engagements. What do you think of that, though?
Well, I think there's the one point of view is that we're moving away from monolithic systems. And that, again, if you focus on we're trying to get a hospital system and what more stuff you need to cram in there, is it best of breed? Is it, it is one system as opposed to, the pie is getting much, much bigger because now it's, analytics platforms, it's getting marketing data and lifestyle data and all these other things that are really expanding the, what is the notion of health, of healthcare. And it's really no longer health IT, it's really more IT for health.
Yes.
Because it involves so many different players at this point.
So tell us a little, you mentioned real quickly in an email what you were doing at Korn Ferry, but tell us about, I didn't realize about this side of the business that you guys are working on. So.
Yeah, well, most people know Korn Ferry as an executive search firm, and I get plenty of calls and emails related to that. But also, we have a very large consulting practice, which has done a lot of work around people and organization issues. And most of the work historically has been pretty industry agnostic around leadership assessment, about culture, about team development, about succession planning and compensation.
Okay.
And now a group of us have come together to bring these capabilities together into deeper solutions focused on healthcare. So value-based care, physician alignment, M&A, employee engagement, sort of the kind of things where we have a lot of systems in place, but organizations often aren't getting the results they wanted because at the end of the day, they got people and organizational problems.
Yes. So what's a standard customer for you in that regard? Who would you approach, or who would be the best candidate for you?
We're working with lots of health systems. Okay. We have both a large provider and payer practice, and also an enormous life science practice on the search side. But really large organizations who are undergoing a lot of transformation. I mean, the way I describe it is, we've had organizations that have been developing their leaders to be race car drivers,
right.
And now we realize what we need are actually airline pilots. And so we just don't have the right people with the right skills in place. And how do you make that transformation?
So looking out over the industry, what best practices? So say you're because obviously a different perspective. I guess from your perspective, what would be some best practices that you would offer to a health system to best navigate that? Or what are some of the strategies that they can look for to be successful?
Well, I think it's part of it's just recognition. They always say the first issue is recognizing you have a problem. And
Totally,
I think, for most places,
knowing is half the battle.
That's right.
Yeah.
Is the fundamental problem they don't realize is that the people they have in place, or the skills those folks have in place, or the incentives they have in place, don't really work. I mean, in a fee-for-service environment, people try to thrive by either becoming more outcomes focused or more customer focused. And they've had a challenge sort of retaining sort of the best of their culture and their best people in order to deliver a great clinical experience and a great patient experience. And that takes a really deep examination of who do you have in charge, what kind of skills do they have, how are they compensated, how do they relate to each other, and can they deal with issues of accountability that go beyond their traditional boundaries? Can they build agile teams? Can they do a lot of things that a rapidly evolving industry faces? And one of the biggest things I find at this meeting this year is that there's a lot of uncertainty with the new administration and a lot of challenges. Are we going to do this? Are we not going to do that? How do you work in such a dynamic and uncertain environment? And that's new for healthcare.
Shifting gears a little bit over to close this on some interesting notes and on the side of some personal level, what do you see and what do you do for fun here? I'll give you an example. One of my previous guests talked about how they got together, a group last night, and went through, kind of brainstormed some unique it actually kind of bounces into your background a little bit, but they're looking for different things to incent employees, and there are a bunch of leaders that got together and just really talked about some incentive tracks, engagement tracks for their employees to kind of keep people inspired, keep people, the creative juices flowing and all that kind of stuff. So it's actually is really neat. It wasn't his company, it was a bunch of leaders got together actually from one of our worlds, and it was a really neat event. So what do you do or look forward to here?
I think one of the most interesting things right now is the discussion about, I live in Washington, D.C., and obviously a very dynamic place right now. And I think one of the most fascinating discussions that we've had lately among leaders, people who would potentially be in an administration, is what role can people play to improve healthcare, and the weird sort of moral and philosophical discussion of what's best for the long term of healthcare? Do you work with an administration you might disagree with? Do you hold back and let things sort of fall apart and then come in later on? So I think that is. I've never seen so much soul searching at HIMSS, and that has been really interesting to see.
Very. Yeah.
I mean, the ironic thing is, last year I was supposed to write a piece for my old firm, Deloitte, which actually is right next door here. Yeah. And they wanted me to write a piece that would be published while I was here on the Tuesday. Tuesday while I'm here, this day. Yeah. And I go, hey, happy to do that. And he goes, look, in order for you to publish it, we need it by Friday for all the attorneys to look at it. I'm going like, the meeting doesn't even start until Sunday. There's no much you need to write. So I actually wrote my impressions
of what Tuesday would be,
of what HIMSS would be, of what I was experiencing before I even arrived in Vegas last year, and it was easy to do. And this year I couldn't do it because again, there's so much uncertainty and so much, that kind of feeling that you just don't know what's going to happen until you really talk to people and understand what they're really concerned about.
Yeah, and actually that would have been a really good reason to come to HIMSS this year. Or listen to the radio show, just get that kind of that vibe, because healthcare is going to shift, it's going to be different, and you got to navigate it successfully. It's how we, feed our families, and it's how we, it's what we enjoy to do. We love it. Yeah. So.
I was thinking, what's great to see, though, is just the consistency of the people who are dedicated to improving this industry and what they're doing for, and, I say, I can see my friends every year because, this group of people is really dedicated to improving healthcare and finding really innovative ways to do it, and have adapted to new technologies as they've come along and new ways, and also appreciated, what's worked and what hasn't. And, so it's, there have been a lot of learnings along the way.
Well, and you bring up a very good point and salient point, because when we looked at the roster of guests for 2017, you want to bring in new blood. You want new people. However, when I went through the names, I'm like, there's so many people that they have to have back. I mean, and you were certainly one of them, but like John Halamka and Anish and Farzad actually didn't end up coming, but just people like that I wanted to make sure that, I had on the show, because I want that consistent approach, but also these are the leaders of our industry. These are who people want to hear from and who I want to hear from and who I want to collaborate with. And so I agree with you. It's a consistency, and it's impressive that our industry has it. We also though, to make sure I got new blood, is we added another hour onto the show. So I want to make sure that we did inject some new people.
Yeah. Well, it's been helpful. I think the other thing too is that for people to have a frank discussion about what's going on here, and realistic one, because and the other thing to remember is, every year HIMSS comes out with a thing saying, we have 1,000 exhibitors and we have 300 new exhibitors. Well, every year they have 300 new exhibitors, which means this is like Jamestown.
Right.
So for 300 new settlers to arrive, like the other 300 had to die.
Right.
And I think, having that understanding of what companies failed, what technologies failed, or why they did, is important. I think the other thing that's important to realize is that we've got some very new, large players coming in. We do. Large enterprise play kind of places that are becoming more and more important. You had, keynotes from IBM. You got Salesforce across the way.
That's right.
You've got other large, organizations that have traditionally catered to other industries, saying, "Hey, we got some interesting tools that, for an organization that, for an industry that's maturing, are going to be important."
Very true. And we actually had Carla was my leadoff guest yesterday, Carla Smith from HIMSS. And she mentioned that this year, 40% of the registrations were new people, new attendees. 40%, usually they're in the 33% range. 40% this year. So that means, to your point, a lot of people dropped off.
I hope they didn't die. 40% of his members have died since last year. Right. But I think it's important also to get, a new group. I mean, it's interesting. I think each year there's sort of a new appeal. I remember for a while there was appeal to get more physicians involved in HIMSS. They've given their own little club, and, as a doctor, I'm, all excited about that. But, we're realizing there are more and more people to become more important. I love seeing the greater involvement of patient advocacy groups, patient engagement groups, and other organizations showing how vibrant and growing this industry and how changeable it is.
So I'd be remiss if I didn't ask about Taro.
So the dog is famous. Actually, it's funny because every time I go somewhere, they go, "Hey, Harry, how you doing? Where's Carrie?" Because my wife, Carrie McDermott. Right. And then, and how's your dog? It's like, I get the two things. No one really cares about me anymore. It's really Carrie and the dog.
Well, I tried to ask you other questions. I didn't care about the dog. I love the dog. It's a Belgian Mammut or?
Belgian Malinois.
Malinois,
which is the same dog the Navy SEAls and the Secret Service use.
Yes.
So but his real, as for my Facebook friends though, his real trick is he can play soccer very well.
Very well.
He's a dedicated soccer player. But I should actually give a plug for my wife's organization, because the Center for Medical Interoperability, they've just launched they're opening a new facility down in Nashville. So they've got a physical place and, and a lab and a bunch of other cool stuff. So, it's interesting. Interoperability is very real at home and abroad. So
there you go. Harry, thank you very much for joining us today. You're always a great guest. I was excited when we were able to fit you in as the last guest today. That was perfect. You helped me close the show very well.
I appreciate the invite. Always great to see you.
Always, my friend. We'll have you back for sure. Thank you very much, Harry.
Thanks again.
All right, bye.
And for everyone listening, thank you for joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor, and you use the hashtag ThisJustIn so you can respond to your comments from this show. In addition, all my content's always posted on my website at justinbarnes.com. Thanks, everyone. Have a terrific week.